Hello everyone, I am Dr. Ronak Tate, gastroenterologist and hepatologist at Fortis Hiranandani Hospital, Vashi. So we'll be talking about a common symptom that is heartburn today. Heartburn is the burning sensation in the chest which can be caused because of the reflux of acid contents from the stomach into the esophagus, that is the food pipe. It can be characterized by pain in the chest or the upper abdomen, or feeling of sour reflux in the mouth. Patients can also experience pain in the neck or the throat, or regurgitation of stomach contents into the food pipe or the esophagus. So spicy food usually contains a content called as capsaicin, which is responsible for causing this kind of a sensation or a burning sensation or a heartburn. So capsaicin reduces the motility of the stomach, and thereby the food stays in the stomach for a long time, which predisposes to heartburn. So now what is lower esophageal sphincter? So lower esophageal sphincter is a band of muscle fibers present at the junction of your esophagus and the stomach. So it has two functions. So while we swallow, it helps in moving the food which is in the esophagus into the stomach, and also prevents the stomach contents coming back into the esophagus. So why are certain people prone to develop this kind of heartburn more than the others? So some people may be more susceptible to this capsaicin, or some patients may have a loose lower esophageal sphincter which predisposes the stomach contents to come into the esophagus, causing heartburn. So what other foods can predispose to heartburn? So spicy, fatty, oily, having carbonated or aerated drinks, too much of onion, garlic, chocolates, citric fruits like oranges and mosambi, raw onions and raw chilies and raw tomatoes, peppermint. These are all foods which predispose to heartburn or a gastroesophageal reflux. So now what foods should you eat? So have more amount of fiber and more amount of dry fruits which are good fats. Have more amount of salads in your day-to-day diet, and other fruits which are non-citric. Try losing your weight if you are obese. Avoid and quit smoking, and try not to exercise or gym at least 2 hours after a heavy meal. Try to maintain a gap of at least 2 hours between your meals and your sleep. Have small, frequent portions of meal rather than having too much meal at the same time. When should you seek medical advice? In case of your lifestyle modifications are not helping, or if there is persistent vomiting or difficulty in swallowing, in case you are on regular painkillers or antiplatelet medications, in case of weight loss or family history of cancers. So thus, early identification of these symptoms and abiding by a good lifestyle and a healthy lifestyle along with medications can help you get relieved of this heartburn or a gastroesophageal reflux. Thank you.